Hi, I am Leilani Barnes, and I will be giving a presentation on assisting those who cannot speak for themselves, specifically identifying pain indicators and interventions for the nonverbal hospice population. Hospice, specifically as the population within their care, has the goal of having limited pain with peaceful transition from life. The objectives following the presentation are to be able to recognize the signs and symptoms of nonverbal pain indicators, including body posturing and behaviors, learn to use non-pharmaceutical interventions to assist in relief, determine what pharmaceutical interventions are necessary, and to understand how to determine effectiveness of interventions for the population. Please pause this video at this time and take a moment to take the pretest. When complete, continue with this presentation. Within the general population, a person will likely be able to explain their pain. They may be able to quantify and describe their pain. This would include the location, intensity, and descriptors of the pain, such as if the pain is ongoing or intermittent, if it is sharp, dull, stabbing, or shooting, if it goes anywhere else within the body, or if it is central to one area, if there is something that makes it feel better, and what makes it feel worse. Often a person may also show their pain through facial grimacing, crying, or crying out at times of intense pain, and guarding the area that is painful. Within the hospice population, there are those who cannot make their needs known for various reasons. Many within hospice have cognitive issues, such as dementia or Alzheimer's. Regression may result in limited to no speech. Patients would not be able to state what their pain is. The person may not be aware that there is pain that is causing issues. Instead, it may manifest in other ways. The person who is often gentle and kind may become angry and lash out at those around them. They may seclude or isolate themselves. Any injury or pain may be guarded by the person, and they may not allow others to see, move, or touch what is painful. This makes it more difficult to determine areas of pain along with what the source is, the pain itself. Due to the possibility that a person may have pain and not be able to express it, there are universal tools that have been created to assist in determining if pain is evident, and also their pain level. While there are a number of tools, the one most often used is the Pain Assessment in Advanced Dementia, or PAIN-ADD scale. It uses a person's breathing, vocalizations, facial expressions, body language, and the ability to console to determine not only the presence of pain, but the degree of pain the person is most likely experiencing at that time. Other tools that may be useful include the Wong-Baker Faces Chart, which determines pain based on facial expressions alone. While this scale is useful in determining pain, it is less reliable than the PAIN-ADD scale as it is focal on one area, whereas a person who is nonverbal may have behavioral changes without appropriate facial expressions, leading to a misrepresentation of pain. Two other scales are verbal and numerical, however, are not used in cases of those who are nonverbal. There are strategies aimed at relieving pain. Oftentimes, a person will focus on their pain when alone, causing it to feel more intense. However, when a person is distracted, such as taking part in activity, conversation, or anything else that would occupy their mind, they may not notice the pain or the pain intensity as they would when they are alone, causing a decrease in their overall pain scale. Changing body positioning and massage are two additional ways to alleviate pain, particularly when caused by prolonged positioning or lack of movement. When non-pharmaceutical interventions fail, or when additional assistance is needed, medications may be given. Hospice may have their own standard medications, such as morphine, to alleviate pain. Morphine, or Roxanol, hydromorphone, or Dilaudid. Oxycodone and methadone are some medications used with hospice. Most often, liquid morphine and hydromorphone are given. Broxenol is not only effective in treating pain, but it may serve additional purposes such as alleviating nausea and shortness of breath in patients. Once an attempt to alleviate pain is initiated, either pharmaceutical or non-pharmaceutical, the person should then be reevaluated to determine the success of the intervention. Success in the case of the nonverbal patient would be evident by lack of pain indicators according to the Pain-AD scale. The goal would be for the person to have normalized breathing, no crying out, no facial grimacing, and a return to normal behavior if behavior changes were previously present. Hospice service is meant for those who are transitioning from life. As such, it is important to remember that when assessing a person, those who once may have had relief with distraction alone may need medication as they continue with their transition. Their medication use may increase. This does not mean that the medication is a failure, but rather that the person's needs have changed. As a person enters their final transition stage, the pain scale, even the pain aid, may no longer be appropriate. A person may only show signs of pain in one form or another, such as a change in their respiratory status. Some medications, once used for pain alone, may now be used for additional purposes, such as to ease the respiratory status or control secretions. As the body shuts down, the person may not posture to pain. Interventions may be aimed at comfort in the form of body positioning and medication only. Elevating the head for those who have respiratory increase and gurgling that is audible is one example of such intervention. Remember, all end-of-life care is aimed at comfort for the person. Now it is time for the post-test. Please pause the video at this time and complete the test. When finished, resume playing to finish this video. Pause the video at this time and take a look at the answer key. When you are finished, resume playing. These are the references used to complete this presentation. Attached is a pamphlet that states the objective of this presentation, along with why it is important to recognize signs and symptoms in pain, along with additional resources on hospice and pain.